And what happens if I can't go cold turkey with
So I wouldn't recommend that you go cold turkey. Cold turkey is less effective than using medication to help you quit.
Yeah.
So I'd strongly advise we try medication and also a counselling service to give you advice and support you through the quitting process.
Yeah.
Quitting smoking is not easy,
No.
even when you want to, and even when you're motivated to do it, let alone when you're not too sure about it and you're facing something challenging like cancer treatment.
On a job site, you see guys that are trying to give it up and they're back to the smoking pretty quick. So,
quit date next week, and a referral to the quit line. So the quit line is staffed by counsellors who are highly trained in assisting people to quit cigarettes.
Oh, okay.
They work around you. They make contact with you at a time that suits you, when it's easy for you to talk. They don't pester you, and they tailor their advice and support to what you need. In terms of medication, we have two options that are commonly used.
Mm-hmm.
One is nicotine replacement therapy. So the main addictive component of cigarettes is the nicotine. The nicotine isn't the harmful part. So we can give you nicotine replacement to help deal with cravings from stopping cigarettes without compromising your cancer treatment. But by stopping the cigarettes, you're no longer receiving the tar and the carbon monoxide and all the other harmful things that were in the cigarettes.
Yes.
We usually use that as a patch medication, which goes on your skin, and the nicotine's then absorbed through your skin, goes into your bloodstream, and as I said, takes the edge off your nicotine withdrawal symptoms, because we're letting some nicotine slowly into your bloodstream all the time. Often people use it with a short-acting form of nicotine replacement as well, of which there are lots of options you can get over the counter at the chemist. So nicotine replacement is one option and is definitely beneficial in reducing cravings and reducing the sort of symptoms people get from nicotine withdrawal. It doesn't replace all the nicotine you're getting from cigarettes, so it's not exactly the same as having cigarettes.
The same amount.
No, it's not the same amount, but it's definitely helpful.
Okay.
The alternative is a tablet medication, which basically reduces your interest in smoking. It blocks the nicotine receptors in the body.
Okay.
And other patients have told me that when they start taking it, they just don't have they lose their nicotine cravings, so they just don't have as much interest in having a cigarette as they had before. Yeah, the urge to smoke goes down. It's also pretty well tolerated. Nicotine replacement therapy and this medication, Champix, is pretty well tolerated. If people get a side effect from Champix, the tablets, it can be nausea. So maybe 1 in 3 people get some very mild nausea.
Okay.
Occasionally, people can have some strange dreams, or rarely can feel if they have depression, their depression is getting a little bit worse. But those things are particularly uncommon. Both medications we use for about 12 weeks.
Okay.
And you would be suitable to have either of those. It's really what your preference is. If sometimes people have a preconceived idea because they've had friends who've used one or the other, and they've seen success with one or the other.
Yep.